The opioid epidemic is something that has affected our country and Philadelphia specifically at overwhelming amounts. In 2017, 1,217 deaths related to overdose were reported in Philadelphia. 469,000 people reported using prescription drugs, 168,000 reported using opioids and benzos, 846 people reported using fentanyl. Opioid-related overdose rates have increased 60% among males and 16% among females. People ranging ages 35 to 45 years old are reported to be the highest age group related to opioid overdoses. This map shows the overdose deaths in Philadelphia from 2017. The dots on the map show overdose deaths in each part of Philadelphia. As you can see, according to the Philadelphia Department of Health, in 2017, the largest amount of overdoses took place in Port Richmond and Kensington neighborhoods in North Philadelphia. There is a rising increase of opioid hotspots emerging in South, Northeast, and West Philadelphia. It is not only important to understand what opioids are, but also the effects of usage biologically and how addiction occurs. Short-term effects of opioids include fatigue, numbness, and absence of pain, feeling of euphoria, drowsiness, and nausea. Long-term effects include irritability, hallucinations, anxiety, and depression. Respiratory depression can cause loss of oxygen to the brain, causing long-term brain damage. Opioids affect the limbic system of the brain. This destroys neurotransmitters and receptors in the brain that are responsible for sensing when the body is experiencing pleasure, contentment, and relaxation. In efforts of ending the opioid epidemic, prevention plays a critical role. Crisis teams are something in Philadelphia that play a large role in prevention. Philadelphia Resilience Project, for example, use of Narcan, syringe service programs, distribution of safety kits, mobile treatment teams, prevention points, and many more are part of the prevention efforts in Philadelphia. Social work efforts, as well as therapy, play a large role in fighting the opioid epidemic. Therapies used for addiction and opioid treatment include trauma-informed therapy, cognitive behavioral therapy, dialectic behavioral therapy, empowerment, evidence-informed practice, harm reduction, motivational interviewing, as well as family therapy, utilizing case management, patient advocacy, individualized treatment goals, and co-occurring disorders, as well as mental health. A few resources provided in Philadelphia for those suffering with the opioid epidemic include community outreach, Pennsylvania's client placement criteria, inpatient and outpatient detox and residential rehabilitation, medically assisted treatments, recovery houses, AA and NA, and many more. There are hundreds of resources in Philadelphia that can all be found and accessed online, such as treatment centers, AA and NA meetings, and other resources. Some websites such as these online can be Alcoholics or narcoticsanonymous.com, meetingguide.com, or Psychology Today. As well as therapy and treatment, social workers also provide a wide range of resources for those struggling in the opioid epidemic. These resources can be things like housing, financial support, seeking for jobs, and many other supportive services. The opioid epidemic has called for many policies and practices to be put into force. The Mental Health and Addiction Equity Parity Act of 2008, for example, fights for mental health or drug treatments to be covered by insurance as they would for any other medical procedure or hospital stay. Another second chance hiring opportunities allows individuals with felony charges on their record to get a chance to be hired at companies who have these programs. The opioid epidemic has become a public health crisis in the city of Philadelphia and all over the world. As we know, addiction and the opioid epidemic does not discriminate and affects everyone. To learn more, you can visit aa or na.com, phila.gov, or if you or anyone you know is struggling with addiction or opioid use, please call 1-800-622-HELP or 911. Help us fight the opioid epidemic by spreading awareness, educating, and helping save lives.